everyone. So today we are going to cover the osteology of the skull. We'll hit the external features as well as the internal features, and I'll be giving you some supplementary information as we go along. So we are going to start with this skull right here, and we are going to start with some of the external features. So this bone right here, this is our frontal bone. That's what makes up your forehead here. The frontalis muscle will lie on top of this. This is what you contract to make the wrinkles on your forehead. As my grandma told me this summer, I need to start my anti-wrinkle regimen. Meanie. Within that bone, we can find our supraorbital foramen. So in some bones, they will actually be complete holes. In other bones, they will actually just be little kind of indentations, if you will. We'll have several nerves coming through here, mainly the first branch of the fifth cranial nerve, trigeminal nerve, the first branch being ophthalmic, which will go and help provide sensory information to the eyes, as well as sensory information to the top of the forehead. As we move down, we'll have our nasal bone here that creates the bridge of our nose. So we know that here is bone, and then as we move down, it's actually cartilage. Contributing to the orbit, we'll have our lacrimal bone on the inside. We have our lacrimal duct on the inside that will drain our tears. After you've been studying for a long time in this class, I'm kidding. And then it's kind of hard to see, but if we stick the little wood stick back here, this will be our ethmoid bone. There's only one. It'll pop up in the middle right here. It actually comes up in the middle of the frontal bone. And we'll talk about these characteristics when we get to the inside of the skull. As we continue down, this bone's actually broken, but they would stack on top of each other. So if this were my ethmoid, this bottom one would be my vomer. Those are going to stack to create the bony portion of the septum. Those will sit in the posterior portion of the nose, so at the back. And if you've heard of septum before, that's what a lot of people have either broken or deviated. That's where they snore or have issues breathing, more exacerbated issues breathing with allergies, things like that. I do not recommend having your nose reconstructed. It is terrible. Only broken mine 6 times. So as we continue down, our cheekbones here will be, actually over here, this will be my zygomatic bone. Okay? So it creates kind of that outer portion or that lateral portion of the orbit. This will actually begin to create this arch. So it's a little hard to see on this skull. It's a little easier to see here. We're going to have this connection point. Now, this is called a suture. This zygomatic bone is going to connect to an extension coming off of our temporal bone. And you can find this on your temple. And they are going to come together to create the zygomatic arch. So whenever you're putting on blush, that's what you put your blush on in your cheekbones. This portion here that's going to create the more medial half of my upper jaw is going to be my maxilla. So this is actually where my upper teeth will insert into these little holes here, called my superior alveolar processes. Okay. We'll see those on the bottom as well, called my inferior alveolar processes. These will be coming up off of the mandible. Okay. This is our mandible here. It's one of the only movable bones of the skull. Okay. We're going to have our ramus here, the body here, okay. Our mental protuberance here, that raised portion in the middle of the chin. We'll have our mental foramen coming out here. Okay. The third branch of the trigeminal nerve, the third branch being the mandibular branch, will come out there. That'll provide sensory information to the lower portion of the jaw there. Okay. We'll also have our coronoid process, which is that front kind of point. That does not articulate with anything. And we've got some ligaments that will attach there that'll help with the chewing process. And then we'll have our condylar process back here on the head of the mandible. And that will articulate up in the mandibular fossa on the temporal bone. Okay? So this is actually, this will create a joint called your temporomandibular joint, or TMJ. If you've ever had that, the locking or the clicking of your jaw, that's where that is. Okay? Let's go, oh, I forgot some things out here. So if we flip to the side, we talked about our frontal bone, we've got our temporal bone here, and creating that temple. We're also gonna have a bone on the side. It's kind of hard to see on this guy. We'll look at it on this one. This, creating one wing of our butterfly, is gonna be your sphenoid bone. Now we can see that once we get into the internal skull better. But frontal, temporal, sphenoid, and then parietal will all come together in this area and attach to one another, or articulate, that's the word that we use with bones. And it's going to create this area called the pterion, P-T-E-R-I-O-N. Now, the reason why this is significant is because this is the weakest point of the skull. So you have an important artery running up underneath this called your middle meningeal artery. If you punch this hard enough, you can cause someone to have a brain bleed. It's called an epidural bleed, and they can die as a result of that. So keep that in mind. As we continue back, coming off of our temporal bone, you've got this huge bump here. This is called your mastoid process. So if you reach behind your ear, about right here, and you push hard enough, you can actually feel it. So a lot of times this is where headbands will sit, or glasses. Okay? If you press it hard enough, it'll give yourself a headache, so I don't recommend doing that. We've got this hole a little bit anterior to that process. This is called your external acoustic meatus. This is where your ear is. And we'll enter into the ear canal, okay, your auditory tube, and then into the internal ear structures. As we flip it over, we have our mastoid process here, and then we'll actually have some styloid processes. There'll be these little two bumps at the ends of my fingers. You can't really see them on here because they've been broken off, but they look like little daggers almost. And you have ligaments and tendons that attach onto them that aid in movement of the mouth, different things like that. And actually the internal carotid artery will run up and by these. If these are too long, they can actually puncture the carotid artery and then cause you to bleed out, which is also problematic. It's called Eagle syndrome. The only reason why I know that is because my little brother has it. So what they do is they make a slit in the back of your mouth, they go in and they shave it down. And then anterior to, or in between our styloid process and our mastoid process, we have that little hole, okay, called your stylomastoid foramen. Okay. Cranial nerve 7, facial nerve, will ultimately leave through this hole. Okay, meaning it comes off the brain, it'll leave the internal area through this hole here. I'll tell you what that is in a minute. And then it will course its way through the skull and then ultimately leave through this hole. Okay. So you're going to hear a lot of words like foramen, fossa, foramina. What am I forgetting? Lots of words like that essentially mean the exact same thing, hole or opening, okay? But make sure you're aware of what word goes with which term, all right? Also, what we can see on this side are going to be our occipital condyles. Okay? These here will articulate with C1, okay? So that we have stabilization of the skull on the vertebral column. another thing to note is, if we move this out of the way. So if we're looking on the underside of the mouth, all right, we're going to have our, this is still our maxilla, okay? We haven't switched bones just because we flipped the skull over, okay? Maxilla, maxilla, all right? We're going to have our palatine bone back here. And then we're going to have our palatine foramen here. Okay? So, I'm sure I forgot something, but if I did, just leave a comment. We'll find it. Okay, hitting our internal skull. So if you remember at the beginning of the video, I made a comment that the ethmoid bone pops up in between the middle of the frontal bone. So this here, this ledge, this is my frontal bone. This is kind of where the frontal lobe of the brain will sit, create sort of a shelf. So the ethmoid bone, this square area, will pop up in between. This little shark fin is called my crista galli. And what it will do is it will serve as an attachment site for the dura mater. Okay, so that helps anchor and keep that brain somewhat stable as it kind of floats around in here. We'll have our cribriform plate on either side, these little holes that allow for the olfactory bulbs to come through there, which is cranial nerve number 1. And it allows for a sensory relay so that we can process smell. As we move back, here, if you can see, is our butterfly. Okay? The one that I showed you on the side, this is our sphenoid bone. Okay? This is going to give us a couple of holes, but let me point out a couple structures before that. So we're going to have our greater wing out here. Okay? Lesser wing is going to be more down here. We have our anterior clinoid processes, also more attachment sites for dura. We're going to have our sella turcica in here. This is where your pituitary gland will sit. Okay. So within the sphenoid bone, we are going to have a couple of holes. So this diagonal hole here, fissure, that was the one I forgot. Fissure is another word for hole or opening. This is going to come through that posterior side of the orbit. Okay, and we're going to have a number of cranial nerves that move through there. We are going to have cranial nerve 3, 4, 5, and 6. Okay, so totally forgot to do 2. We'll do that in a second. Cranial nerve 3 is oculomotor. It's going to provide motor function to the eye. It allows us to look around as we see fit. Fun fact, the eye does about 75,000 movements a day. Cranial nerve 4, which is trochlear, that is going to innervate superior oblique. Okay. That is going to cause movement of one specific eye muscle. We're going to have first branch of ophthalmic, which is going to leave through here, V1. Okay. Cranial nerves have to be written in Roman numerals, that's why it's called V1. And then 6, abducens, that's going to innervate lateral rectus. That's going to pull our eyes sideways. Okay. Also, if you notice, there's another hole coming through that posterior side of the orbit. Okay. So then if we look inside, our optic canal, right there, is going to house cranial nerve 2, the optic nerve. Okay. This is another nerve providing sensory information to the eye. Okay, so we have 1, 2, 3, 4, 5, 6. Okay. Foramen rotundum is going to be this little branch, or this little hole right there. Here it is on the other side. This is going to house the second branch of trigeminal, so V2. This is going to be maxillary. Okay, that'll provide sensory sensation to the middle of the face. Okay, so below the eyes and on top of the maxilla, kind of out this area. And then as we move back, we have foramen ovale. Okay. That is going to house V3. Which is mandibular, the mandibular branch, okay? Providing sensory sensation to the lower portion of the jaw. And then this little baby hole right there is going to be foramen spinosum. Okay. For you guys, you don't need to know anything that's coming through that. Also, you don't need to know this hole right here. However, it's a good landmark. It's called foramen lacerum. So if you can find this hole, it's located most medially, and go immediately lateral to it. I thread this pipe cleaner through there. Coming off immediately lateral to foramen lacerum is going to be our carotid canal. And can you guys think about what might come through the carotid canal? Get this through. Our internal carotid artery. So if you guys watch slasher movies or those terrible Scream 27 movies that were made in the 90s, okay, whenever people get their throat slashed, usually the spurting of the blood, they've gone through the carotid. First, they have to hit the jugular vein, and then they'll hit the carotid. Okay? But if you find foramen lacerum most medial, coming off laterally this little tunnel, canal, we can flip it over, and that's the pathway that the internal carotid artery would take. So, if you remember, that's our what? That's our styloid process, right? So you can see how if this were too long, that would poke into our internal carotid artery, causing a lot of problems. So as we continue posteriorly, we get into our temporal bone. Immediately behind this little ridge is going to be our internal acoustic meatus. So if we're paying attention to the naming, okay, the naming is going to give away the fact that this hole is going to run to the inner ear. So it's going to house cranial nerve 7, which is facial nerve, and cranial nerve 8, which is vestibulocochlear. Vestibulocochlear will split into two branches as soon as it leaves this hole. It's going to split into the vestibular branch and the cochlear branch. Vestibular branch is responsible for balance, okay? And the cochlear branch is responsible for hearing. What's interesting is, for example, when you guys go out on Friday night and you've had too much to drink, only if you're over 21, of course, the vestibular nerve and the vestibule inside the ear is what's affected when you can't walk straight. So it causes this perilymph and endolymph inside the ear to go from a gelatinous state to a water state. That's why you fall all over. Okay, so fun fact. Okay, so cranial nerves 7 and 8 run through there. Immediately inferior to those is going to be this larger hole. It's much larger on this skull here. This is going to be our jugular foramen. Show you here. This is going to house cranial nerves 9, 10, and 11. 9 being glossopharyngeal. Glosso means tongue. Pharyngeal means pharynx and the throat. So it will help with things like taste as well as swallowing. 10 is going to be vagus. That is going to play a role in autonomics. So the part of the nervous system that we have no control over, so our visceral organs, things like that. And then 11 is spinal accessory or accessory. You can use either one interchangeably. And that's going to provide motor innervation to your sternocleidomastoid, okay, as well as your traps. So allowing you to shrug your shoulders, bring them down, retract your scapula. things like that. And then we'll see on this larger hole, this is called your foramen magnum. This is where your spinal cord will come up and attach onto the brain. Fun fact, cranial nerve 11, spinal accessory, is the only cranial nerve that does not come directly off the brain. It actually comes up off the spinal cord and then leaves through jugular foramen. So, kind of weird, kind of interesting. On the outer lip of the foramen magnum, we have this very tiny hole on either side. It's called the hypoglossal canal. That's where cranial nerve 12 is going to exit. Cranial nerve 12 is the hypoglossal nerve. This is going to provide motor innervation to the tongue. So this allows us to speak, stick our tongue out at our little siblings, things like that. What we can also see internally here as we move posteriorly, we have our occipital bone here. We'll have our internal occipital protuberance, this bump. That's all that's inside. Outside on the occipital bone, we'll have our external occipital protuberance. This is where the majority of us wear our ponytails, on that bump back there. And then here we'll have our nuchal line. Okay, you do not need to distinguish between superior and inferior. This is actually where your trapezius comes up and attaches. Okay? And some other neck muscles that allow you to go back into extension. Okay? So extension is where I go from anatomical position and I make my joint angle larger. Okay? All right, that is osteology of the skull. No, it's not, just kidding, do not hit stop. Totally forgot about the skull cap. So this is the skull cap. This is what sits on top. Okay. So this would be my frontal bone here, 2 parietal bones, and then my occipital bone in the back. So we will have connecting my frontal bones and 2 parietal bones. This is going to be my coronal suture. Okay. It follows my coronal plane, or it's where you wear your crown, if you want to remember it like that. Running perpendicular to that is going to be the sagittal suture. Okay? The coronal and sagittal sutures will meet at this junction called the bregma. Okay? And then we have this wonky looking suture that connects the occipital bone to the parietal bones. This will be your lambdoidal suture. Okay? And this connects at the area called the lambda. Okay. And then if we look at it on the side, this skull cap does not go to the skull, but you can see this brief outline where temporal is connecting to parietal, sphenoid, as well as occipital. This is our squamous suture that runs along the side. Okay. These fuse as you grow from a child into adulthood. Okay. These are meant to be tight, they're meant to be closed, they are not meant to be popped. Okay, I'll talk about that. I'll tell you a story later on in the semester. Anyway, now we're done. Please let us know if you have any questions.